This week marks 2 months since the COVID clinic was opened here at FMC, and I know for a lot of us it feels a lot longer than the 2 months. I couldn't be prouder of our team, how they've come together and what we've achieved. We've swabbed over 5,000 people since the clinic opened, and as many of you are aware, that's more than anyone else in the state. I think it's important to recognise that it's not over, but we're in a really fortunate position here in South Australia, and it's because of everyone's hard work and commitment. And I'd just like to take this opportunity to say thank you.
Well, the first day here was really going into the unknown because the clinic was set up quite rapidly and they sort of pulled together staff from across the hospital from different areas. None of us really knew what to expect and didn't know just where the pandemic was going to go in South Australia.
The first shift we had in the clinic, it was a Monday and it was very busy. I knew it was going to be surreal, and it felt very surreal. We knew we were going to be busy, but I had no clue as to how busy it was going to be. And so coming through and donning the PPE for the first time, it felt very much like coming into a MASH set. It was organised chaos. We were all very busy, learning the ropes on the job. But it was fun and it was exciting and very different to what we were used to. So we just all pulled together as a team and got the job done.
For the last couple of months, there's been a very big difference in the way people are when they're approaching the clinic. In the early days, there was just a lot of anxiety and a lot of people, and that certainly started to ease in the last couple of weeks as our numbers have looked much better and people are feeling a lot more confident, I think, and not as frightened out in the community.
My interactions with a lot of the patients has been a good thing. I had a lady the other day who was waiting to be tested. She actually got up and came up to me personally and thanked me, which pretty much put a tear to my eye, and I've never really had anything like that said to me before directly, so that was really, really nice.
I've been a nurse and midwife for the last 26 years, working over a huge number of variety of areas throughout the hospital, and I can honestly say it's been quite an unusual experience. I've never felt so appreciated by so many members of the public coming through that seem to just really appreciate what everybody's doing here, and just so thankful.
I still find it quite surreal that this is a global pandemic and I have a part in it. I'm quite proud of it. I'm quite happy to have some sort of legacy in it, I guess you could say. But I don't think of it as anything unusual in the sense that this is my job, this is what we're trained for, we use all the right gear, we're professionals, it's what we do. But yeah, there is that element of pride in what we do. Being
At the forefront of something that I've certainly never experienced in my career before, and a lot of my colleagues who are much more senior than me have also not experienced. And so it has been quite rewarding to be able to be here as it's evolving and see how it plays out.